I can remember clearly my doctor telling me that um, at the rate that things are developing as far as treatments, you'll probably die from something else other than myeloma. Yeah, you'll always have it because it's not a curable disease, but it's treatable. I was out playing basketball with some 20 and 30-year-olds, which I should have been doing in the first place. But it so happened I went to catch a ball, bent my finger back, and this is an injury that I was very familiar with. It's happened multiple times in the past. But for some reason, it took about 2 weeks and it still didn't heal, which was very unusual. I had a primary care physician who was also very diligent in looking at some of the symptoms and tracking the trends that were taking place in my system. Number one was there was an elevation of protein that was present both in my urine and in my blood. He put two and two together and said the elevation in your blood and urine, and pair it with this issue with the fracture, and we'll send you to a specialist. So I started going to a nephrologist because I was experiencing kidney dysfunction. He then sent me to a urologist, ruled out anything that's no prostate. Then I went to a hematologist and then ultimately an oncologist. We did the biopsy probably the day after we met, and the results came 2 days later and confirmed that the diagnosis was multiple myeloma. I thought it was melanoma. For some reason, more people are familiar with the term melanoma than they are myeloma. It didn't really sink in until probably when I started getting chemotherapy that this is something that's life threatening, right? And I may not have much control over it. It's not the type of cancer where you can actually focus and pinpoint. It's not a solid tumor. This is blood. So that runs throughout your entire system. The regimen that I took was a 6 month chemotherapy, followed by a high dose of chemo prior to my bone marrow transplant, just to flush out any trace of myeloma. So when they reintroduced my T cells, and by the way, I was able to get an autologous transplant, which means that I was able to donate to myself. Very fortunate that not everyone can do that, and so a lot of folks have to go find a donor. They were able to harvest enough T cells for me to, use my own plasma. So did that, and that seemed to work out good for me. There was also, I learned later on, there was some condition in my genetic makeup that made it favorable for me to follow that standard treatment. I talked with Dr. Ajai Chari of the University of California, San Francisco about the latest breakthroughs in multiple myeloma treatment, including CAR T cell therapy, bispecific antibodies, and why clinical trials are critical for expanding options for all patients.
I would say this is my passion, is the personalization of therapy, right? There are no two patients alike. And you can read about a clinical trial, you can go to a patient support group, you can talk to a friend, but that doesn't mean that's the right treatment for you. We've literally had hospice conversations with some people. We're like, but let's try this study. And those patients are now in their most deep and durable remissions in their entire myeloma journey, despite having had all those drugs. And I think that's a clear example. If you've run out of options, then you should be looking for new strategies, right? Myeloma is not one of the most common tumors, right? So the most common cancers that are seen are usually breast, colon, prostate, and lung. I bring that up because if you're a patient that's diagnosed in the community, chances are your oncologist is very experienced with those cancers, but maybe not as much with myeloma. And studies show that outcomes for patients who are affiliated in some way with an academic center do better. %50 of that information in a first cancer visit goes in one ear and out the other, because you're dealing not only with the diagnosis of the cancer and the intellectual questions, but the emotional part. So I think it's always good first to have a friend or family member to listen in on all of your conversations so that they can help catch some of the things you might have missed.
Move. That's the most important thing. Move. But I think that really helped with my recovery. It also helped with my mental and emotional state. There's a mental component to getting chemotherapy. It's called chemo brain, and it's real. I mean, it can cause depression, and heavy dose of chemotherapy will definitely impact your behavior. For me, it was about becoming more vulnerable, telling my story without feeling like, I'm exposing myself. And it was for the purpose of helping people get something out of it. When you get out on stage and you tell your story, you don't know who's listening. So some days it's a hit or miss. You may feel like, you didn't hit a target. There was a quote that Michael Jordan talked about, how many times he missed, the game-winning shot, and how many times he failed. But ultimately, he was the best at the game because he kept trying. I feel pretty good. I can still go out and I can run, a few laps around the track. I can lift weights. So, and most of all, mentally and emotionally, I think I'm intact. So that's the most important thing.
Number one thing patients are looking for is, I think, hope, right? I think they want to know that they're going to be able to live as long as they want to live, and not just long, but with good quality of life.
You have to be your best self-advocate, and you really have to ask questions that may make you feel uncomfortable for your own well-being, right? Whatever you used to do in the past, okay, this is now the time for you to really advocate for yourself. You want to catch whatever it is early. Early diagnosis is the key to recovery. And so don't be satisfied with a non-answer or a I don't know, or if you need to see a specialist, you really have to push through that and find a way to be your own best self-advocate.